Hi, I'm Renee, and I'm working on Dr. Wang today, and as you can see, Dr. Wang has pretty nice skin. So we've already put numbing cream on. She's numbed for about 15-20 minutes, and we're going to remove this. And instead of doing microneedling with PRP, platelet-rich plasma, we're going to be using exosomes. So exosomes have been the newest addition to improving the quality of the skin. And the good thing about that is that we don't have to do a blood draw. Exosomes are much more potent than the platelets that we were getting when we were drawing the blood and spinning it down and extracting it from the buffy coat. So what are exosomes? I mean, there's a scientific version of it, but they're part of our normal cell function. And the good thing about exosomes is that we have stem cells, which we know can replicate. We have growth factors that kind of fertilize stem cells, but now we have exosomes. And they actually communicate with each other. They'll communicate with the lipids, they'll communicate with the amino acids and the protein. So it just puts a much more technical approach into the treatment of what we're doing on our skin. Now I'm going to start with the numbing cream. It's very tolerable. The addition of exosomes partly into doing treatments is that they reduce inflammation. And inflammation is always the biggest culprit into healthy skin. So being able to reduce inflammation in the skin is just a great way to stabilize the skin, make it stronger, make it healthier, refine the appearance of the skin for sure. So everybody wants to remove lines and wrinkles. Everybody wants even skin. And feeding the skin, fueling the skin with the combination of growth factors and exosomes is just, it's raised the bar very high. So I've done several passes, and it's just easier to apply the solution once you've mixed it and reconstituted it by just putting it directly on the skin. Now you should see a lot of the redness calming down relatively quickly. And that's the beauty of using exosomes. I'm going to let that absorb in a little bit. We've done the channeling. I'm going to go to the next side of her face, cheek area. The exosomes really do a tremendous job in healing you quickly. So we're going to go ahead and treat both the neck and the décolleté area today. I did not put numbing cream on the décolleté. I put it on the neck. And I will be using a slight different formulation. So a lot of times people are surprised at how little redness they may have when they leave here. Some people do have a lot of redness, but it's dependent on the needle depth and the skin type. So you don't have to have like blood red all over in order to succeed in getting a good treatment. Now I'm going to be using a different formulation. This has more hydration in it, and this comes in a roll-on. So we're going to use this for the neck and the chest. There's no negative response to doing this. You can't do anything wrong. And so the more you feed the skin, the better it is. This can be used on the face as well, this solution. It was just my preference to use this on her for hydration. and to use the stronger exosomes as far as potency goes on the face.
Everything feels great so far. The numbing cream did its job. I think my lips still feel
A little numb.
funny. So, but yeah, it didn't hurt. It was a little bit tickly, sneezy right by the nose.
Yeah, the nose, when you hit the sinus area. Now I'm just putting a little bit of hyaluronic on right now.
Love hyaluronic.
Yes. It's a good companion with the exosomes, the hydration. Not bad. And by tomorrow, you should look pretty normal.
Yay!
Thank you.